Welcome back to another vlog. This weekend I am here alone. Tessa's in Los Angeles. I'm working again. Didn't show you that, so I'll do a little bit tomorrow morning. But the plan otherwise is to start tearing stuff down. So the shoe rack, already gone. We're gonna be selling it soon. This mirror is gonna come down. I've already done a whole bunch of other stuff, like Kyoko's corner is pretty much gone. So slowly wrapping things up. We have 2 weeks left here. So might as well get stuff going slow and steady. We're about to PRP my knee. This is Dr. Minkley, one of my attendings here. We're over lunch, looked my knee under ultrasound here, definitely some fluid, so I'll vlog some of this. If you're squeamish and you don't want to see like medicine, injections, that type of stuff, don't watch for like the next, I'll put a skip ahead mark on there for like what time frame you should go to, but otherwise, if you want medicine type stuff and injections and needles, watch this.
I'm going to walk you guys through a little bit of this, but PRP starts with drawing your whole blood, which is what this is, that eventually gets spun down and turned into the product that you'll see in just a second here.
So this is our tray. This is the sterile tray. Our MA accidentally put this onto the tray and made it non-sterile, but all of this is still good. So we're just gonna do with what we can because we don't want to waste an entire kit. As long as what's going into my knee is sterile, I'm fine with that. That's your ultrasound, which we're gonna use. May or may not use this big x-ray machine that we look at the images here. Mostly gonna look at ultrasound. We're gonna draw this PRP up into a syringe. I'm gonna help Dr. Minkley transfer that into there using that green connector thing. Those are all sponges to clean my knee, and there's some needles, all that kind of stuff. We'll walk you through this so you guys know what it's like to get a knee injection.
I'm going to use this opportunity to pretty much walk you guys through a joint injection. The first step is to clean off the skin. Make sure that it's sterile so that you're not introducing any sort of skin bacteria or anything else to it. Wear sterile gloves, sterile precautions, all that kind of stuff. And you want to visualize the joint to see what you're getting into. So you can either use different tools like ultrasound or x-ray. In this case, we're using ultrasound because we want to see what's in the knee itself and the different structures. Under x-ray, you can just see bone, but you can't see what's actually inside there. So the first step is to put some numbing medication. So this syringe and needle here is putting some lidocaine to the area to hopefully make things less spicy, which they weren't. Because we used an 18 gauge needle, which is a pretty big needle, so that we could draw out whatever fluid was in there. I don't know if you guys could see on that ultrasound before, but what you're seeing here right now, that entire large pocket that's like dark or black in there is pretty much a pocket of what's fluid, or what's called hypoechoic fluid. And in this case, we were trying to drain it. So what you see there's the needle kind of moving in there, trying to get into that pocket, which you'll see a little bit better later on. But Dr. Minkley's trying to maneuver that needle to get into there to try to draw out whatever fluid is in there. In this case, nothing came out, so we think this is probably some sort of congealed blood that's in the knee. So we tried that, and then eventually weren't able to get anything, so we just injected some of the PRP into that joint, which I don't think I got a video of. But PRP is nice because you can kind of split it up into different areas. You don't always just have to inject one area. So we put some into the knee, which you're not seeing, but this is exactly where it went, where the needle is right there. We then moved on to some other areas, like some of the ligaments next to the patellofemoral area.
And the MCL area.
Which is around the kneecap, essentially on the medial or inside of it. That's where if I did sublux my patella, then I felt those ligaments would stretch and come back in, and that's where I do have a fair amount of my pain to the touch, so we figured it was good to PRP those as well. So that's what you see here. Injecting into a larger space like the joint is not quite as painful because there's room for the fluid to go, and there's not as many receptors inside the joint itself. It's more so on like the ligaments and outside skin and whatnot. So when this needle is going in here, this is actually relatively painful, if not at least comfortable and stinging. So essentially he's just moving the needle around and getting a couple different places so that we can make sure we maximize coverage of as many ligaments as we can in the medial portion of the knee.
A little bit more here.
This is not the most fun, but now I know what it feels like to be a patient getting an injection, especially with PRP. PRP is supposed to burn a little bit more than your usual injection, but there's a little bit of numbing in there as well, which would be good.
And then for this last part, we went for the medial collateral ligament, or the MCL, which is kind of on the inside, and you can see it right there on the ultrasound. That's the joint line you're seeing. You're seeing the two different bones, the femur and then the tibia, kind of in that area, and the MCL spans those. So this is what we're injecting here. Same idea. This is where I had force go inwards, opening up that joint, so probably sprained
This is
this.
the needle coming in from that angle.
So here you can see that needle getting into the MCL and really just putting some of that PRP into there, which you can see that space opening up.
Voila. Heading home from work. I don't know if you guys watched my last PRP vlog when I had it done for my hamstring, but essentially what you can expect is some soreness in the joint for a little bit because of that pro-inflammatory kind of cascade that starts that healing process. I definitely had some achiness going on more than what it already was, but I took some Tylenol. You're not supposed to take any non-steroidal anti-inflammatories or anything just that's not anti-inflammatory, because you want to have some inflammation right after getting PRP. That's the point. So you shouldn't take anything for like 2 weeks, essentially, is my rule. But definitely a little bit sore. Took some Tylenol. It's better. Driving home. Not going to work out today. I'm going to try to do some quick walking tomorrow, see how it's feeling, and then kind of progress from there. PRP takes weeks to work for the long term. Usually when we have it for patients, we have them follow up in about 6 weeks, but more or less because I get it cheapish at my practice, I'm gonna use it for an acute injury, see how it does. I'm gonna keep pushing on it. Hopefully it does better, but let's see. It is Thursday, driving to work right now. We have our ASC day, so I'm headed off to go do, I think, 5 or 6 intercept cases this morning, which is fantastic because I got a lot of reps right before leaving here. I think I also have 5 or 6 next week as well on Thursday, so I'll have plenty of cases right before I leave fellowship here, which will be fantastic. It has been really strange in Phoenix recently as far as the weather goes. There's just been like massive dust storms. Usually there's water/rain that follows afterwards that kind of clears things up a little bit, but there has not been. So it's just extremely hazy and it's all just dust. So if you look at all the cars, they're all just extremely dusty. Everything's really dusty, and the AQI is 250. So very interesting weather in Phoenix right now. Other news today is my little graduation event. They're throwing a little happy hour for it, so I'll take you to a little bit of that, and then that'll probably be it for this vlog once that is done. So then I'll upload it, and then we're on to the last week of fellowship after that.
Yep.
And that's it for the vlog. Most of it was knee PRP. I guess an update as of today, it's Thursday, so I got that PRP done on Monday. Now, knee is definitely starting to feel a little bit better. Have not still been able to run. I tried a little bit, but not happening. Still doing some fast walks. Just out of clarity and everything, I decided to get an MRI of my knee. I know I'm usually a type of person who wants to just wait it out, and it's only been like 2 real full weeks since this, which I wouldn't expect any significant healing to happen, but because I have an ultra and a marathon coming up, I just want to make sure there's nothing like catastrophic potentially going on in the knee, so I figure it's good to get an MRI, so I'm gonna get that tomorrow, which will be in the next vlog. But other than that, not too much more. I have 1 full week left here, which is very exciting. So stay tuned for the vlogs. They will be hopefully a little bit more exciting as we get out of Phoenix. See you in the next video. Thanks for watching. Make sure to subscribe.